Hi everyone, I'm Dr. S.M. Khutbuddin Ali, consultant ophthalmologist. So, as part of regular healthcare education video, today I wanted to share a few things which may not be directly related to your eye health, but definitely an overall picture of your general well-being. So, today I would like to share one incident that happened at my clinic today. I had a patient, a female patient in her early 30s. She was complaining of fever, headache on and off, and irritation in the activities which she is doing. She was not feeling interested in her day-to-day activities. So, as an eye doctor, there was nothing much from my side to do. I have checked her vision, and she was referred from some general doctor, general practitioner, for the complaints of headache, that there might be some eye problem which has caused her headache. So I examined her. I have found that there was a small refractive error. That means eye problem which could be easily corrected with a glasses prescription. Apart from that, when I was doing her retina examination, I had put dilating drops, and after some time I had checked her retina and optic nerve. I found that it was not looking normal. So the normal color and the findings which you see in a healthy patient, they were missing. So when the optic nerve head, which we call optic disc, so it was looking pale, the margins were little blurred, we call it in technical terms. So I have advised for an MRI investigation. So after that they have, and then I have advised to have a follow-up once she is done with the investigation. So they have come today. That was about 1 week. So once today I saw the patient, she was looking very weak. Her husband was also little tense, and I just made them relax and asked what the problem was. So her husband told that from the time I had advised an MRI, she didn't have a peaceful life. She was very anxious. She has inquired all her friends and family members what this test is about and everything. So they told her that if there is some major problem only, some physician or doctor will advise an MRI, and whatever they could tell, they have told her. So from right now what I see her, I could say that she is a very anxious patient. She is also claustrophobic. Actually, she had, the good thing is she had done her MRI, and the time she went to the what you call scanning center for the MRI also, it was a very big task for them. The staff were well trained enough to make her relax, and they help her in all ways to get the MRI done. And finally the output is that the MRI is normal. So I told her that you have done good thing, that you have revealed all those things now, and the good things I would tell from my part, that the MRI is perfectly fine. So definitely there was a big sigh of relief on her face, but at the same time that had put me into question whether advising an MRI or investigations which are not regular basis done, how far is it apt that you explain all the pros and cons, you explain the procedure also, and also you have to judge the patient's general health status, her mental health status also, if she is anxious and everything. And there are many queries, because these investigations are quite expensive. Majority of the patients, definitely they would like to have a second opinion from their relatives or from their doctor they know. So this, I told her that this is one investigation which will help us to rule out any neurological problem, and luckily that turned out to be normal. But that had a deep impact on me. That is whether you should advise the MRI for a patient only after referral to a physician, or can you, being an eye doctor, is it okay that I get it done? And also the patient's behavior has also to be assessed before doing this. So post COVID, I see many of the patients, they are suffering with anxiety issues, having a loss of their closed ones during those times. They have become little more or less fearful of all the situations, something about their health, something about their what you call losing someone, or about their health also. This is in issues of psychology, we call it as catastrophization. That is when something is explained to them when something, when issue happens, when an incident happens, these patients, the patients who have anxiety issues with this cluster, with this catastrophization, they overthink. They think what will happen to them later on, what will happen once something happens to them, and how will take care of their family, and after that all the maximum negative consequences that might happen, they think. So I advise all the general practitioners, whenever they see any patient, just make sure talk with them, discuss with them, and during this process they can assess if they have any anxiety issues or not. Majority of the patients are open enough nowadays to discuss these issues like anxiety and depression, but even if not, if they feel that it is not the right way to discuss to a general physician, only a psychiatrist or something has to be informed about their psychological well-being. No, everybody, all the healthcare staff, they can know it and they can share their problems. When once they know that this needs some proper care with a trained psychologist, or if it is a problem bigger enough that it has to be dealt with medicines, they can consult a psychiatrist also. And during this thing, recently I found a short video in YouTube, a short video in Telugu, that one of my doctors, senior doctors in my medical school, he was sharing a short video, like he would prescribe a medication which is not available in any of the pharmacies, but that is definitely the best thing for your healthy lifestyle. There are things which are not available in medical stores. He was saying things which caught my attention, which we know, but we have to practice. You and me have to practice. One thing is proper physical exercise, proper good thinking. Think good about yourself, think good about the others. Smile, always have a smiling nature. Smiling is one of the things that is least bothered in our culture sometimes, because we have a feeling ki once we accept someone, we greet someone with a smiling face, we don't know are they expecting something from us or whatever, but always have a smiling face. Definitely take care of your health. Good food, the things he was mentioning was in a very funny manner actually. So the quantity of food should be less, the quality should be quite good enough, and whatever you have a good friendship, having a circle of good friends is the one thing that will definitely boost your health. At part of time in school life we have a big bunch of friends, then college we have one. Once you are into a married life, your circle of friends restricts to one, those who have close knit with your family. It is difficult for us to maintain close knit ties with our friends, which we used to give time enough to. But make sure that you have quality time with your family, quality time with your friends, and most importantly, don't overthink what might happen in the future. Even nobody knows. We are not astrologers, and I doubt whether they know too. So what happens is, what is there in our hands is today is called present is gift. So the gift we have is today, and let's not worry about tomorrow, and maintain a healthy lifestyle, and believe your doctor. Talk with him, whatever queries you have, whatever anxiety issues you have, whatever doubts you have, you can tell. Any doctor would be happy enough to give his or her best opinion. In the sense, when you find that the practice doctor is busy enough, you can request him for an appointment where he is free enough to share all their queries. And it is always better to have a full opinion about your health, your doubts, before having some anxiety, all those things that will deter your health. Thank you. This is just to share what happened in my clinic today, and that was also a good thing for me, that I should ask the patients, I should give the patients a little more time, or if I find I'm busy in my practice, I should give them some appointment where I feel happy enough to give enough time to them to listen all to their queries. Thank you. Have a great day.